Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Kachoa. Here I am, and I've partnered with them to bring you an easy and educational workday session. Today's session, just like you saw on that previous slide, is summer back health. We're going to be preventing and managing pain in the warmer months. A little bit about me. I'm a physical therapist and owner of Par 5 Physical Therapy here in Randolph, New Jersey. And I've been in the PT field for probably over 20 years now, close to 25 years. I got my exercise physiology degree from Rutgers University, got my doctorate from Mercy University in upstate New York. I'm a certified orthopedic specialist, certified dry needling specialist, certified golf fitness instructor, certified CrossFit level 1 coach. So I've seen everything from the side of fitness as well as the patient side and as a medical provider side. And dealing with low back issues is something that's like in my wheelhouse, because the first time that I had back pain, I had a back injury, was my first exposure to physical therapy back when I was like in high school. And then again, I had it again in college. And then throughout my 20s and 30s, 40s, I've been dealing with like chronic issues that if you know how to deal with it and manage it, then you could, have a good time, be able to do things that you love to do without being too apprehensive about back pain popping up. So without further ado, folks, let's get into our slides here. So summer back health, preventing and managing pain in the warmer months. All right, now, because I am a medical professional, I have to put up this slide here that if you're dealing with something specific, please, you have to get a thorough physical exam, because the stuff that we're going to be covering today is geared or aimed at a broad population. If you're dealing with something specific, you have to get that physical exam because you want to be able to assess and treat all the root causes that are connected to your issue. And if you just kind of go through some of the things that we're going to talk about today, you may be able to control your symptoms. It's very useful information, but it might not be the ultimate solution. All right, so let's get into it a little bit here. There's this thing about posture, right? You're probably sitting, doing some work in the office or at home at your in your home office, and you're wondering, like, what about posture? Is there a way that I should set up my workstation, or is there a way that I should sit to reduce back pain? Well, I'm going to tell you that there is no such thing as perfect posture. Our bodies adapt to the positions we put it in throughout the day. So whatever we expose our bodies to, whether it be movement, exercise, static, lounging, or sitting, our bodies will adapt. Now, basically with soft tissue structures like muscles, tendon, fascia, ligaments, skin, all of that stuff can become very sticky and very stiff if we're sitting in one position for too long. So even if we're sitting with a straight back, shoulders back, head over the shoulders, and very erect, those positions here are not ideal for a prolonged position because our bodies are designed to move. Movement is medicine. It helps improve blood flow circulation. And we'll talk a little bit about what to do when you're sitting. All right. Now, just a little quick review of what the spine is. What's the back? The spine is made up of these segments here, these vertebrae, these bones, and we divide them into cervical, thoracic, and lumbar, the neck, the mid back, and the lower back. And you could see these curves in the structure, and these curves naturally help to dissipate force, provide shock, and help with movement. All right. A lot of times with the static positions that we get ourselves into, we may change these curves. The lower back may become a little bit more rounded instead of a little bit more extended. And the mid back becomes even more rounded. And typically I see people lose the cervical curve. That curve, the neck becomes flatter, again, because we spend so much time looking down in front of us. Because our workstation's there, our phone's there, our electronic devices are down here, and our neck becomes flatter. So we want to be able to restore and maintain these curves here. And sitting up tall and moving the joints is our number one tool to do that. You can also notice here that there's discs in between these vertebrae. These discs are about 80 to 90% of water. They have a harder, stiff outer covering, the annulus, and a soft inside. And it acts like a gimbal. It allows for movement between those bones. But because they are so filled with water, hydration is key, especially in the warmer months. Our body becomes dehydrated, our tissues become dried out even before we become thirsty. So you should be able to drink how much water during a day? People say like 8 ounces or a glass, how many, 8 glasses or whatever. The truth is that you should be drinking half of your body weight in ounces. So for a 200-pound man, that's 100 ounces of water per day. And if you're going to spend a majority of it outside doing some type of sporting activity where you're sweating a lot, you want to preload your body with that water. 20% of your daily intake should be consumed in the morning prior to your physical activity throughout the day. All right, so that's key. You look at how much you weigh, cut that in half, and that's how many ounces you need to intake throughout the day. And I'll say this is that plain water, straight water, isn't as digestible or absorbable than something that has a little bit of electrolyte in it. And you can purchase a lot of these little tabs or these little juices that you can kind of drop in your water to make it more flavorful and add electrolytes. But the bare minimum would be just to get simple sea salt, coarse sea salt, and just put a pinch of it in that water. Not so much that you can taste it, but just enough to add electrolytes and help with that absorption. All right? And the other thing with the back health and managing it and maintaining it is body mechanics. How do we lift? How do we carry? How do we move things around? We'll get into that in a second. And, when we're dealing with back pain, if you do have a flare-up, one of the things that I always tell my clients is that keep a diary. Figure out what positions, what movements make it worse, and what movements, what activities make it better. Because typically, people will start to develop a directional preference or positional preference, if you want to call it that. If we break down the spine movement into flexion, which is bending, and extension, which is extending or going backwards, we can divide, like, say, sitting, which is more like a flex position, or standing and walking, which is more an extended position. Which of those positions make the back worse or better? If you do one more than the other, does your back hurt more or is it less? So once we figure out this directional preference, we can kind of work into the direction or movement and make that an exercise to reduce your back pain. And then once we can get your back pain under control, maybe take it down to a 0 out of 10 intensity, then we start to build in the opposite direction of movement so that you are able to recover full physiological function of your body. Now, keep in mind that the body functions on this alternating pattern of stability and mobility. If this pattern is disrupted, then pain or injury is going to be the result. So specifically with the lower back is designed to be a stable segment. All right, so this alternating pattern of stable and mobile segments throughout the body, from the foot all the way up to the hand and into the neck, we have to maintain those roles. Let's say, for example, if your hip is classified as a mobile segment. If it becomes tight, if you lose range of motion in your hip, it becomes stable, becomes stiff. So then your body starts to think about, all right, how do I regain that range of motion, that mobility that I lost at one segment? I'll just take the next segment up or down and make it a mobile segment. So tight hips can result into a mobile back or unstable lower back, which can create all these issues. And also the hip The next segment below that is the knee. And if there's a hip problem and your tight hip, you might have a unstable knee. So all of this is connected so that when we treat somebody, we want to also treat the entire body, this whole chain right here, so that we can get to the root cause of the problem and address it 100%. All right? So everyone, my philosophy is that everybody should be able to maintain their own body with simple exercises, either done daily or regularly throughout the week. All right? It's your body. You should be able to take care of it. You should know how to take care of it and not depend on anyone unless you need to go see a specialist. For example, like if you have a car, you know which side the gas cap is on. If you're in New Jersey, you don't have to pump gas. You just go in, make sure you're on the right side, and then boom, they pump it. Or how to add windshield wiper fluid or whatever, or add air in the tires. So that's simple maintenance to make sure that your car is functioning well. You need to be able to do that. But if your transmission or electronics kind of crap out, then you need to go to see a specialist. The same thing should happen with your body, that you should be able to do certain things to maintain your body. And if something falls off, then we need to go see a specialist. All right. So let's go into some of these key exercises that we talked about. I'm going to pull up my two-shot here, other camera, make sure that we have no questions. And, feel free, again, I want to make this session's class as interactive as possible. So if you want to use the chat, there's some questions that, information that you're not certain about, you want me to go over, let me know. All right, so we talked about sitting posture that perfect posture is never a thing called a perfect posture. So if you're sitting, you're at work, I've got this whole keyboard and screen set up and I'm sitting up nice and tall. The thing is that these are a lot of 90-degree angles that we're looking at here. And again, our body's not designed to be in any one static position. So at the very least, every 30 minutes, we want to change position and add circulation to these stiff spots. So the very simple movement that I usually start off with is a slouch movement and an overcorrection. Now, if you can kind of see my pelvis here, I'm moving the pelvis forward and backward, tilting the pelvis forward, tilting the pelvis backwards. So as I'm tilting that forward and backward, my lower back is arching and rounding, all right? Typically, when people have poor motor control or coordination of their pelvic movement, they start to do this and then make the head and upper back do a majority of the work. But really, when we're talking about lower back, we need to be able to move the pelvis forward and backward. And this pelvic tilting exercise is one of the key beginning points of adding nutrition and circulation to those discs in your spine and maintaining that joint mobility. The next one, because we are in this position for such a long time, we tend to get tight hips. The front part of the hip, all this soft tissue tends to adaptively become short. Most of the time, people come in, they feel like when they come up into standing, they get a lot of back pain because they can't straighten out their hips all the way. When you get tight in the front part of your hip and all of this soft tissue gets restricted and adhered or sticky, then what happens is that when you try and stand up, because you can't open or straighten the hip, the back, let me show you over here, where am I? Right here. The back will start to extend too much, and then we'll get an overuse issue with the lower back muscles. So opening up the hip, one of the simple exercises that we can do is called a hip flexor stretch. Now, there's a lot of different ways, a lot of different variations to do this exercise. It's to stretch out the front part of your hip. The muscle that we're intending to stretch crosses several joints. It starts on your lower back, wraps underneath or deep in the abdominal cavity, and ends up and exits and inserts in the front part of the leg. So as we're doing this stretch, we get into this position, this half kneeling position. The key point is to make sure that both ends of this muscle are as stable as possible. Just like a rubber band or a slingshot, you can only create stretch if both ends are stable. So the first movement that we want to do is really lock down the pelvis by contracting the butt cheek, the glute muscle. If you squeeze or contract this glute muscle, it'll take that pelvis and rotate it posterior, or you get this posterior tilt. It tilts backwards, tucks the tailbone in. And then once we do that, We're going to keep the abdominals on to connect the ribs to the pelvis. And then you might even just feel a stretch there. If we need more stretch, maintaining those 2 points contracted, we're going to go forward. And you should feel the stretch pretty early on in the movement. You don't have to move that far. If we keep all of this relaxed and not on, you could probably go a lot farther and have to search for the stretch before you get it in the front part of your hip. Now, if you can't tolerate being on your knee, you could certainly put some foam padding or a pillow or a cushion underneath there. But you could also do the same thing seated in your chair. You kind of scooch to the edge of it and then bring that leg back. It's not touching the ground. I'm going to hold on to the other end just to stay balanced. But I could do the similar type of positions and try and slide this foot backwards to open up that hip. When we're doing a static stretch like that, you want to hold it for at least 30 seconds and breathe and relax through it, because that is going to be the most effective way to calm down the nervous system and allow that muscle to relax to create a permanent change, a permanent lengthening. All right, let me just take a look at my list here. The other thing that can get tight because we're sitting is the hamstring. The knee is bent, so this muscle can be short. And if we're going to go pick something up, a lot of times people will feel that their hamstrings become tight, but it might not be a tightness. It might be some weakness in the glute, but that's another class that we can go over. But the simple hamstring stretch that you can do is you can do it seated as well, out in front and then going forward, or in standing. Now, I'll show you in standing because I want to show you the position of the pelvis. Now, similar to that half kneeling hip flexor stretch, when we're doing like a hamstring stretch, I like to start with the knee partially bent. All right, so we don't create too much tension on the tendons of the hamstring. And then from here, similar to that hip flexor stretch, we want to engage the position here by just extending the spine. Now we got to get like that anterior tilt. So you're going to stick your tailbone out, keeping your tailbone out, your back arched a bit. Then we're going to go forward. As I tilt forward, I'm tilting at the hip. I'm not going down and rounding the back to get this stretch. Again, very specific. We're just trying to separate these 2 points, the back of my knee, back of my hip. I don't want you to go down and kind of reach forward. So again, we're going to be reaching, trying to get that stretch and doing a lot of other things, stretching the back and whatever. It's not very specific. So to make it specific as possible, we're going to lock up the lower back, keep that pelvis tilted forward, tailbone out, and then partial bend of the knee. And as we kind of flex our body from the hip, keeping my back straight, I should start to feel that stretch through here. And again, it's a 30-second static hold. All right. Now, we talked about how if we're bending forward and I'm here, either I am going to bend forward, like one of the tests that I typically give a lot of the clients that come in is, can you go down and touch your toes? All right. You could try it right now, feet together, right? Knees straight. And then you're going to round out the back, send the hips back, and then see, can you touch your toes without bending your knees? The knees have to stay straight. Now, one of the things that can happen is that people will start to feel like, oh, this feels so tight. But there's other tests that we can do that can truly assess whether or not the hamstring is short or the hamstring is just on. It doesn't turn off. For a muscle to turn off, we need to be able to use other muscles to hold ourselves up against gravity. So if I'm bending forward, what happens is that our body senses this position here, bending forward, and we use muscles to hold us up so we're not falling forward, falling flat in our face. So it's either the hamstrings start to turn on to keep our body upright from falling forward, or the glutes actually need to turn on to allow our body to go down into this position and stretch out, versus the hamstrings turning on, and then you start to get that stretch. And then this plays into body mechanics. As we're trying to pick something up off the ground, we want to maintain a stable core, the spine, the lower back, not moving. Let's just call it the two-handed rule. One hand on your sternum and then one hand on your belly button. When we're going to move or create force or lift or carry stuff, the two hands should never come together or come apart. Once we set that, that's going to be our standard core stability point to move stuff and lift stuff. So if I set up and I have this object that I'm going to pick up, proper body mechanics is going to be bending from the hips and the knees, not just from the knees. Because if I do this and start to go down, what tends to happen is that my back stays straight, but I put a lot of stress on the knees and my heels come up, which is a much less stable position to create force and carry and lift. What we want to do is keep your foot flat. Cores engaged, two-handed rule engaged, and then send the hips back. I'm bend the knee slightly. So in this position, my back remains straight, although it is not vertical. I'm in this position, I'm stabilizing my lower back by using the abdominals. I use my glutes to extend or straighten the hips as I stand and lift. And that's one way, lift or move things off the ground to protect the spine. If we're doing some athletic type of movement, that's just, whether it's golf, tennis, whatever, we want to be able to use the hips and not take the knees forward and be more stress. You're the position and activate and use the glutes to hinge at the hip. It doesn't I think we had like a technical hiccup, but we are recording. Hopefully everybody's in the room. I just might talk about your body knows motion and doesn't know muscle, so you have to include your brain. That slide, you know how technology is. Let me pin myself here. Am I in? No? Yes? Oh man. All right. Anyway, hopefully you can see me. I can't see myself. Oop. All right. Anyway, well, a lot of technical issues going on right now. There we go. Well, you got the basics. Perfect. That's it. That's it. Awesome. Awesome. You can't see me. Now, can you see me? I don't know. Hopefully you guys can work. Wow. That's never happened to me before. So that's, I'm glad that you were able to get the basics. Anyway, let's wrap things up. Thank you for joining me today. You can look for this session and many more on demand on any of the Better Spaces apps. I'm going to be back Tuesday, August 27th, that's next week, with Back to School, Back to Sports, Injury Prevention for Fall Athletes. So with the return of the school comes the excitement of fall sports and the activities. So we want to be able to enjoy the thrill of competition and reduce the risk of sports-related injuries. So join me then next week. If you have any questions about this one or the next session or anything like that, feel free to call me, text me, email me at Paul@par5pt.com or team@betterspaces.com. All right, thank you for coming and be well.